Hello, Miss Jones. My name is Hannah. I will be your nurse today. Can you please state your date of birth and name for me? At this time, I would check the wristband. I do see that you've been having some troubles urinating. I did receive an order for an in and out catheter. Do you have any allergies to shellfish, beta iodine, or latex? All right. I'm going to provide privacy for my client. I'm going to raise the bed. Then I'm going to position my resident in a dorsal recumbent position. At this time, I now will wash and dry my hands and apply gloves. How are you doing today, Mrs. Jones? I'm about to provide pericare for you to make sure we prevent any infections. All right. I am always going to wipe from front to back and use a different part of my washcloth, and today I have 4 washcloths. All right, I'm going to provide pericare, Mrs. Jones. Discard. 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 All right, Mrs. Jones, I'm going to turn you. I would discharge. All right. Position my resident back. I now will remove my gloves. And wash and dry my hands. I'm now going to organize my supplies. Miss Jones, is it okay if I keep this bag down here as a little trash bag? All right. I have a 1-inch margin as well. I am now going to apply gloves. You doing okay, Miss Jones? All right, Miss Jones, I'm going to apply a drape under your butt. I'm going to remove my gloves, dispose of them, and wash and dry my hands. At this time, I'm going to apply sterile gloves. I also have a 1-inch margin on these as well. It's okay if I do it right here, Miss Jones? All right. Okay. I'm going to grab the middle since it's sterile. and dispose. I'm going to interlock my hands. All right, I'm now going to organize my supplies. And during this procedure today, I would use beta iodine swabs, but for this video, I'm going to use just cotton swabs, and I would apply lube, but I'm just going to say that I will. I then would insert lube right here. These are the cotton swabs I will be using. All right. I am going to place the drape over the peritoneum. I am also going to place my non-dominant hand and separate the labia, exposing the urethral meatus. At this time, I'm going to lube up my catheter. All right, Miss Jones, I'm going to insert the catheter. Before I would have lubed up and put the catheter in, I would clean using beta iodine swabs. I would go outside, dispose, down the middle, dispose. Then I would have lubed up my catheter, and now I'm going to insert it 2 to 3 inches until there is urine. And once I see urine, I'll do 1 to 2 inches. And then I wait until all the urine is depleted, and I may press on her bladder at this time. I would also observe the characteristics, the color, the odor, and how much output there is. All right, I'm now going to remove the catheter, Mrs. Jones. I'm going to dispose of my supplies. I then would remove my gloves. I then will position my resident comfortably. I would wash and dry my hands and apply gloves and do another peri-care. Then I would take off my gloves and wash and dry my hands. And then I'm going to position the resident in a comfortable position. Doing okay, Miss Jones? All right, I would lower the bed. Then I would report and record the indication of why we use the catheter, what type of catheter, the size of the catheter, any supplies used, the intake and output, the characteristics of the urine, the color, the odor, any teachings that were used, and how the client did throughout the procedure. And then I will give the patient the call light, and Ms. Jones, let me know if you need anything else.